The following program contains mature subject matter. Viewer discretion is advised.
When we think of those suffering with eating disorders, many people picture young, thin women exclusively. The question is, are stereotypes about eating disorders keeping doctors from diagnosing others who might be in danger? A recent study from the University of Michigan found females are 5 times more likely to be diagnosed with an eating disorder than a male. Psychotherapist and the author of Chicken Soup for the Soul, Think, Act, and Be Happy, Dr. Mike Dow, joins us now. Hey, Mike. And it wasn't just, it wasn't in this study, it wasn't just male versus female. It was also body type. White students 2 times more likely to be diagnosed versus students of color. Overweight students were half as likely to be diagnosed. You spend so much time in your career dealing with individuals struggling with eating disorders.
I do.
And you've told us before that sometimes the individual suffering from an eating disorder is not at all what you would picture.
That's right.
And kids end up suffering, and adults as well, because they're not getting diagnosed.
That's right.
Mike, it's obvious. If you see somebody that is rail thin,
Yep.
that immediately comes to your mind.
50, 60 pounds, yep.
However, if you see somebody normal weight or overweight, it doesn't pop up.
But they're still suffering.
They are.
They are.
But for them, it's so much easier to hide it because you know, the whole thing with eating disorders, they're ashamed, they're afraid to talk about it. In their case, they can hide it a lot easier than the anorexic, for example.
Absolutely. And remember, anorexia is just one of many eating disorders. Binge eating disorder is the most common eating disorder. Anorexia is the one we all think of, but it's actually the least common of the eating disorders. Dr. Travis, the study highlighted something that's really, really common in mental illness. Men are much less likely to seek treatment for mental illness. That includes anxiety, depression, and that certainly includes eating disorders. And I think this is something that we really need to talk about. And if you are a male and you have an eating disorder, or if you are a normal-sized, average-sized person and you look like everybody else, or overweight, you can still have an eating disorder. You know where an eating disorder starts? Right here, in between your ears. It's not about the size of your body, it's about the way you feel, the way you talk to yourself.
If this is the reality, how do we change the circumstances?
Yeah, I think we really have to start with the way you love yourself, right? I've treated people who are 600 pounds, I've treated people who are 50 pounds, and I've treated people in between. I have found that they have a lot in common in the way that they talk to themselves, in the way that they feel about themselves, and that's the root.
So for people out there saying, well, I want to know if my family member or my friend, if they have an eating disorder, like what are some big red flags?
Yeah, so if you have somebody in your family who eats normally, says they're fine, and then you go down to the kitchen in the morning and then all the food is gone, right? Binge eating disorder. Binge eating disorder, by the way, the most common eating disorder, much more common than anorexia or bulimia.
Really?
Yeah. If you
Binge
eating disorder, yeah.
And yet anorexia is much more likely to get diagnosed.
Yeah, absolutely, because in anorexia, you're gonna see it, right? You're gonna see that 60 or 70 pound person. If you see somebody who is leaving the table, that's sometimes bulimia. If you're seeing things in the toilet, if you see symptoms in their teeth. Bulimia probably also more likely to be diagnosed than things like binge eating disorder. Binge eating disorder, people can hide it more.